Hello, my name is Tom Magondo. I'm a student at Eastern Kentucky University pursuing a psychiatric and mental health nurse practitioner program. I'm here to present to you a topic of interest and choice, which is Alzheimer's disease. I narrowed it down to focus on weight changes that occur along with the disease. So, with this topic, I'd like to give you a few insights and facts about Alzheimer's disease. What's Alzheimer's disease? Alzheimer's disease is an irreversible disorder of the brain. It is the most common form of dementia. According to CDC 2013, 5 million Americans live with Alzheimer's disease. People aged over the age of 60 are at the highest risk of Alzheimer's disease. Does not even get any better. People at the age of 65 with Alzheimer's disease doubles every 5 years. The number of Alzheimer's disease patients is projected to rise to 2050 to 14 million individuals. So you can imagine why this is a big healthcare problem. Problem. Here comes the big question that guided or triggered or guided, led my study in patients diagnosed with Alzheimer's disease. Um, how is stable weight maintenance compared to progressive weight loss affect Alzheimer's disease progression and treatment outcomes over 3 months to 1 year post-diagnosis? However, I did focus on the long period of time to come up with the study findings. All data was relevant. However, all the information that I reviewed covered many, long period of time with the studies to come up with the conclusion. So, so mainly the reason why I was interested in these topics is because of the observations that I've had working with this kind of patients before in nursing homes and of course in hospital settings and you know I work in psych, so I get to see these patients in geriatric psych units and one of the issues that has come up or I have noticed is that these patients tend to lose a lot of weight. And of course, we know other factors. They don't, memory is an issue. They don't remember, to adhere to nutritional requirements. And of course, they constantly need somebody to redirect and assist with the, compliance. So another question that I had to ask myself, does this weight loss propels severity of the symptoms in the patient with Alzheimer's disease, or does Alzheimer's disease propel severe weight loss? So that's another, thing that we have to ask ourselves. Um, so I did review 5 studies to support my question, and I chose 4 data to narrow it down. 2 of them were systematic reviews of data from well-organized cohort studies, a multi-center prospective study of an Alzheimer's disease patients, a meta-analysis of a random control trial. So these topics have had some subheadings, and the first one was again, talking something to do with changing body mass index before and after Alzheimer's disease onset. A study of body mass index, weight change, and clinical progression in mild cognitive impairment and Alzheimer's disease. Third study was weight change in Alzheimer's disease patients with increased aberrant motor behavior. And of course, the final one, which was body mass index in midlife and late in life as a risk factor for Alzheimer's disease. Reviewing all these studies, I came up with a conclusion which, kind of supported my question. There is a positive relationship between weight changes and Alzheimer's disease severe symptom. I mean, weight changes and Alzheimer's disease severe symptoms, yes. Uh, Progressive or severe weight loss is also related to progressive and severe symptoms of Alzheimer's disease. Patients maintaining ideal weight and appropriate body mass index have a good outcomes with Alzheimer's disease. Caregivers, we can't stress enough, they play a pivotal role in ensuring Alzheimer's disease patients adhere to dietary and nutritional needs. Also, progressive or rapid weight loss is fatal for patients diagnosed with Alzheimer's disease. It does not get any better. They lose the weight, the severity of the symptoms progress because, of course, there's also other nutritional needs that we are losing. Sufficient staffing is required to effectively manage Alzheimer's disease patients' weight problem. All studies suggest more studies needs to be done because the topic is so broad, so many directions to go with the study. So where do we apply these findings? Typical patients, as we know, they have a lot of needs. So few patients will be at home, and majority with the setup that we have here is in nursing home, assisted living, group homes, or geriatric psychiatric unit. Thank you for listening and have a nice day.